Hi everyone, it's Rehman Chishti here, the Member of Parliament for Gillingham and Rainham. Today I kick-started a series of In Conversation with Rehman Chishti talks with experts and policymakers looking at topics of the day. And today I was absolutely delighted to be joined by Professor Allan Young from King's College London, looking at mental health and the impact of COVID-19. I hope you enjoy listening to the interview today. In the future, we'll have experts covering foreign policy, security, trade, and a variety of other areas. Thank you so very much for watching the video today, and I look forward to sharing future interviews with policy leaders and experts with you in the future. Thank you. Professor Allan Young joined King's College in 2013, and he's head of the School of Economic Psychiatry. And he is considered one of the world's leading experts in psychiatry and psychology, and has published over 500 peer-reviewed publications and a number of books. So I'm absolutely delighted to have Professor Young with us. Professor Young, great to have you with us today to discuss this key topic of COVID-19 and mental health.
Yes, good morning, Mr. Chishti, and thank you very much for inviting me to speak with you.
Professor Young, just a number of questions have been put to me by individuals and organisations outside to do with mental health. And before I go on to that, can I just say a big thank you to you and the team at King's for providing the note on mental health, COVID-19, and individuals who suffer from severe mental health, because that note I passed on to the Prime Minister, and we've now have a response from the Prime Minister with regards to what the government is doing to address many of those challenges. So thank you to you and the team for that report that we shared with the Prime Minister.
Thank you very much. And the Prime Minister's note was very encouraging. I think what the government's saying it's going to do actually sounds terrific. But of course, it's all about delivery and making it happen in the right way. So we look forward to seeing this process unfold.
Great, thank you. I look forward to working with you on that. The first question I have for you today is, what will be the impact of the economic downturn due to COVID-19 on mental health?
Well, I think it's going to be bad. I mean, our president of the Royal College of Psychiatrists, Dr. Adrian James, has highlighted that we're seeing a real detrimental impact on the mental health of the population because of the pandemic in general, and this will continue because of the economic circumstances. And of course, for many people, work is essential to their feeling of well-being and their good mental health. At the extreme end, there's a very worrisome correlation between increases in unemployment and increases in suicide rate. When we talk about mental health, I think we can think of it in two ways. We can think of the mental health of the general population. And of course, everyone has felt a bit anxious and stressed and perhaps even down in the dumps about what's happened in the pandemic. Many people have had caring responsibilities where they've been asked to do almost impossible things, where you're supposed to work from home and look after small children who can't go to school and so on. So it's very important that we think about the mental health of the general population. And then there's the people who suffer from frank mental ill health. And during the pandemic, when it was very much in crisis mode, these people very often got left behind. And we need to think about reparative action to picking up the care of people with already existing mental health problems, mental ill health, because they're a very vulnerable group. It's nice to see that they're being prioritized for the vaccine, which I think is very important.
And can I just ask specifically on the point with the economic downturn and comparison to the economic downturn we had in 2008, where people lost their lives and you had a recession during that. Have lessons been learned in relation to the challenges that were faced then with regards to the impact on people's mental health to where we are now? I know it's a completely different ballgame, but we did have an economic downturn in 2008, which affected so many people and would have had a real impact on their mental health.
Yeah, absolutely. I mean, there was an impact. We can all remember the so-called Great Financial Crash. But my amateur understanding of the economic outlook is that the economic consequences of COVID are likely to be far greater. So there's going to be a sort of quantitative difference. And also the problem with the pandemic is it seems to be going on and on. So many people were to some extent energized by the crisis back in the spring and summer of 2020. But then when we get into the third lockdown and so on, there's a real feeling of exhaustion. I think there's data from the great financial crash, which is really important to learn from. One is the correlation between unemployment and suicide, and there's studies from North America showing a pretty tight correlation where unemployment goes up and suicide goes up. And also there's perhaps a new situation with children and young people. So we see this in high schools and universities, where people are, their education is being severely disrupted. And I think we must think about that in terms of the maturational goals that we've all got to achieve as we grow up. And key in these are things like taking exams properly and going through the whole stressful situation with that. That's an important maturational goal. Going to university, forming a new social group, separating and individuating. One of the things that's really astonished me as the father of 4 young people, as a parent of 4 young people, is that the need for socialization is really quite hardwired, and depriving young people of this has been very traumatic and damaging. So I think there's a lot of issues here which impact wider society.
And that is a question that which we'll come back to later on with regards to the COVID-19 and the impact on young people. Can I ask you just specifically 2 other points with regards to the COVID-19 impact on the economy and mental health? The number of people who are likely to have mental health issues with regards to what they've experienced due to COVID-19 and the current circumstances. We've had a figure of 500,000. The Centre of Mental Health has estimated 500,000 people to have new mental health problems due to COVID-19 economic downturn. Is that something you could relate to? And also, do you think that enough resources are there, through what the government's doing? I know previously we had 2.5 million being announced for mental health with regards to the NHS plan, plus the 500 million recently in November specifically with regards to addressing waiting times. But the scale of the issue that we've got coming our way, and with regards to the adequacy of resources now and the future, what do you make of that?
Well, I think the first thing to say is that the media, the press, and really all of us like a simple figure that we can hang things on. And if you say an extra 500,000, that sounds like a big deal. My view of it, my considered view, is slightly different. Mental health problems are extremely common. The English National Mental Health Survey, which was published in January last year, just before all this happened, showed that about 1/3 of people in England will suffer a mental health problem during a year. So it's not 1 in 20, it's not 25%, there's roughly 25% will experience a mental health problem. I think there's 2 issues about this. I think COVID is shifting a lot of these people to the more severe levels. So many mental health problems are relatively transient and maybe mild to moderate. And I think there's a real possibility of people going up a level of severity where they get stuck in more severe mental health problems for longer. And I think that's a real issue. I think there's also a contrary, very difficult problem, and that is that we must avoid pathologizing everyday life. One of the problems with mental health is that we all suffer anxiety, we all suffer stress. There are some symptoms which probably the general population don't experience, such as hearing voices and so on. But nevertheless, it's normal to be anxious. It's normal to have low mood at times. And this doesn't necessarily equate to a disorder. So my colleague, Professor Sir Simon Wesley, when he was president of the college, made the point that we should really be focusing on the people who have actual mental health problems. Now, I think that's certainly true, but bear in mind what we said about the well-being of the whole population, because this will also stop people, hopefully, getting mental health problems and getting stuck in more severe and long-lasting mental health.
And just on that, and that ties into the second question I have for you, and that's with, you touched on it with regards to depression and anxiety. What types of mental health issues, such as depression, anxiety, have increased due to COVID-19?
Well, the big issue in mental health is depression, and depression's twin, if I can use such a term, is anxiety, and they very often go together. So I don't think that we'll see an increase in psychosis. We may see people with psychosis doing worse. Very severe mood disorders like bipolar disorder, these people are vulnerable, but I don't think we'll see bipolar disorder precipitated by the crisis to the same extent as depression. But depression is so common, and is, if it weren't a mental health problem, if it was a problem in another area of medicine, it would be one of the biggest healthcare problems, roughly equivalent to heart disease. So I think it's going to be depression, and this is because of a number of factors. The stress of what's going on with the whole situation, and the loss of factors which we find rewarding in everyday life. So there's things that we just can't do which actually maintain our good mental health. Going to the cinema or going out for a meal or socializing with friends, those aren't allowed at the moment, and that will be hitting hard on lots of people. I'm also concerned about anxiety because we've certainly seen some people, and this is not necessarily, I'm talking about people I know socially, who have become almost phobic of going out of the house and have become very avoidant because of the pandemic. Now, I think most of that will be dealt with by the vaccines, which I think are very welcome, and I think everyone should have their vaccine. But there will be some people who get stuck in a phobic avoidance pattern and actually don't socialize, go out the house, or even potentially go back to work the way they did before. There is data from China showing that if you can return to work, it's actually good for your mental health. So it's actually less stressful to go back to work, given that work has the correct protocols for social distancing and hygiene and so on. But the structure, the interaction, the social aspect of work, these are all very, very important. And also a feeling of purpose and feeling that we're doing something that's good for others is very important.
And can I just ask, so that those listening outside can help one another when someone's going through a difficult moment, with regards to anxiety and depression, what would you say are the signs to look out for those around loved ones or friends who are going through a difficult moment? Everyone has their own difficult moment, and sometimes they may not show it. So what are the signs, would you say? I know it may be difficult for people to pick out, but what are the signs to look out for with regards to anxiety and depression, so that one can help one another in that difficult time? Because sometimes when one is going through anxiety or depression, they may not want to reach out. How do you put yourself in the best position to be able to understand another's needs then?
I think you hit the nail on the head with saying they may not want to reach out. And people very often feel that they shouldn't actually talk about these things. I think as human beings, we're actually quite good at picking up how other people are feeling. But what very often happens is we feel if we talk about these things, we will make things worse. And it will be discomforting for the person. But I think actually asking how people are, checking in with them, asking how their mood is, asking, just talking through these things in a way that normalizes the experience. Because one of the things which I think might be positive about this whole pandemic, and there aren't that many things yet that are positive, is that mental health has become an issue for everyone. No one can sort of deny that their mental health is a feature of everyone's life, and in a way that people's general physical health is, of course. So when everything's going tremendously, we take it for granted. You don't think about your heart if it's working correctly. And similarly, you don't think about your mental health. But I think everyone's been forced to think about that. I think also one of the things that I keep telling my patients is to avoid the drumbeat of negativity in the news and social media. It seems to me a feature of current news programs that things are all almost unendingly negative, and there's a great deal of criticism. Now, we live in a very skeptical country where people like politicians are held to account, and that's a good thing. But you can have too much of this, and I think actually limiting the amount of exposure that you have to things like news is good. So I think we need to be aware that everyone's in the same boat. We need to talk to people about it, and we need to try and not pathologize things too much, but if it is more severely, present, then that's usually obvious to most people.
Thank you. My next question for you, Professor Young, is this. What have been the effects of COVID-19 on the treatment of mental health patients that they receive, and how likely are they to receive access to that treatment in these times?
Well, this is certainly an evolving story, but at the height of the pandemic, we in London, where I work in South London, we had perhaps 40 to 50% staff shortages. And I must say our staff in the South London Maudsley Trust were magnificent. They worked very hard. It was kept going by the other. The people who could come to work, and of course people were following government advice, they were isolating, they were quarantining, or they were actually ill. And of course we had people, well, the Prime Minister was in one of our hospitals in St Thomas's. So at that time, and that was a crisis, the mental health services had to reconfigure very rapidly to sort of deal with the biggest pressing issues. Now, there was a paradoxical effect, as I understand it from my colleagues in mental health services across London, in that the demand for many mental health services dropped because people with mental health problems don't usually, they're not usually people that are particularly entitled consumers and will demand treatment. So if there's no reaching out to them, there'll be an apparent lack of demand. But what went through the roof was urgent admissions or assessments or seeing people in casualty. And that's because the usual care had been reduced markedly, and therefore people got extremely unwell. So this was a real sign to us. So that was during the crisis. We've reconfigured things really quite remarkably. So we do a lot of things remotely. I think this is good, but I don't think we can do everything remotely in the future. I think we've got to have a face-to-face component. And indeed, some of that has continued, and hopefully we'll do more of that in the future. But the remote and face-to-face, the remote and non-face-to-face work, I think has been a godsend. You can phone someone up or do a Zoom call with someone anywhere in the country, and that does compensate. And we've also been, on a more practical note, trying to reconfigure services so medication can be delivered, blood tests can be done by people popping to the GP and so on and so forth. But it's still evolving, and I think we might see mental health services that are a bit different after this. And this may well have brought some good practices in, but just be wary of throwing any babies out with the bathwater.
Yeah. And can I also ask specifically on the remote working, and I think is the point you touched earlier, there's some people who need help with mental health, and they may not be the ones who reach out to get help in the first place. And therefore, if you have remote access to services, some of those individuals may not have access to remote connectivity, and there might be some in society who may not be too familiar with IT and connectivity through the help they get on mental health. Is that a challenge, or do you think that is a challenge which can be overcome?
It is a challenge, of course. I just think about our own neighbourhood where I live, and we formed a support group for everyone in the neighbourhood. And there was only, I think, one or two people who were well over 80 who didn't really have any access to the internet or smartphones. They had landlines, though, and we were able to phone them on the landline. And I think the figures bear that out. The penetration of smartphones and so on is really quite striking. And it doesn't have to be a Zoom call like this or a Teams call. Some of my patients actually prefer phone calls because they don't necessarily want to have to, change their appearance and put their makeup on or whatever, so they can see me at 9 o'clock in the morning. They're quite happy to have a conversation. I think that's fine for follow-ups, but my own view is that a lot of acute assessments where you actually initially see the person, there's little, there's less scope for remote. Now that we do that, we see people from abroad, we've seen people from Gibraltar and so on remote, but it's not really as good as seeing the person in the flesh. So hopefully we'll have a mixed model in the future.
Got it. Can I ask another specific question? And that's with regards to decrease in the number of referrals. I've got a Nuffield Trust report here, which says there was a 61% decrease in referrals to IAPT, Improving Access to Psychological Therapies program. And my question to you is, does this indicate that people are not getting the help that they need?
Yes, again, I'd be slightly wary of a one-off figure, because I suspect the referrals to IAPT went down markedly during the peak of the crisis.
Right.
But I think you might see a compensatory massive increase afterwards. And I think if you look at it in the round, that's perhaps the correct way to consider it. But certainly at the, as I said, at the height of the crisis, and remember, we've just come through. Possibly, we're just coming through at the moment, possibly something that was worse than last summer. There was a real reduction in people coming forward, but that didn't mean that they were unwell, not unwell.
And can I just ask a specific question? And with regards to, a year on now, with in one form of restriction or the other, with COVID-19, and looking at the severe end of the impact on mental health. My specific question to you is this: what has been the impact of COVID-19 on suicides so far, and particularly on men? And what does the outlook look like as we move forward from these restrictions in the coming year?
Of course, suicide is what we might call a lagging measure, because you get the data somewhat after the event, and it usually is for the year. And I think this must be considered against a backdrop where the suicide data in this country for a while were actually very much going the right way. But I think there's no doubt there's very worrying indications of an increase in suicide rates. In this country and in many countries, there's a peak of suicide in late adolescence, early adult life, particularly with men. And this is something which covers a group that's very vulnerable, and I would suspect that is likely to be increased. The other real peak is in later life, and by that I mean the elderly, where again it's men who are socially isolated and physically ill who are at particular risk. So I think those two groups are particularly worrisome. This isn't actually true in every country. I was speaking to a colleague from Eastern Europe yesterday, on Zoom, of course, and they were saying that the pattern in certain parts of Eastern Europe is different, with the gender split being different, but that's the situation in this country. Fortunately, there's been a lot of investment in suicide studies with the Centre in Manchester and so on, and there is good data, and this is something that people are very alive to as an issue. And
can I just ask you specifically, just following on from what you just said, with regards to the issue with that men face and with regards to women? I've got the data from 2019, suicide rate, deaths per 100,000. It's a 16.9 for men and 5.3 for women. Why is there such a big difference there? And every life that's lost is completely unacceptable. But why is there that big difference between men and women?
Yes, it's always been there that women have more attempted suicide, or call it what you will. People have called it parasuicide, or forms of deliberate self-harm and so on. But there's more completed suicide with men. I suspect there is actually a cause of this which is rooted in the brain, men's brains mature a little bit later than women. That's no surprise to most people. And also the brain maturation is, the lag in brain maturation is there for that period of time that we see this increase in suicide for young men, which is late teens and early 20s. If you throw into that mix, some degrees of macho culture, exposure to drugs and alcohol, loss of supports because they're not getting the usual resilience promoting factors related to socialization and work or university or so on, you can see why it all might lead down the same way. But I think men are essentially more vulnerable, especially during these particular age age epochs, if I can use such a term.
And can I just ask you a specific question on that? We've got two further questions, but specifically on this, are you able to clarify if the suicide rate has gone up or gone down during the past pandemic year? I know sometimes we don't get data, so therefore you're not able to draw a comparison to previous years. But with regards to the impact of the pandemic and with regards to the suicide rate, has that gone up or has that gone down?
Well, I mean, I'm fudging it a little bit because one could see there being two different effects. We know that when there's a societal crisis, suicide rates often go down temporarily. So, for example, during Northern Ireland, during the peak of the Troubles, suicides went down. And this is because of more cohesive societal bonds. But I don't think that really applies in the pandemic because of social distancing. So I think it has gone up. Yeah, so I think that's a real worry.
Can I ask you a further question? What can be done to normalize seeking medicine help for mental health issues, specifically during COVID-19?
Well, I think there's a real issue of public education. And, we've seen lots of change in public attitudes to things like race, to sexuality, and so on. We've really changed the way that we behave about these things dramatically, and obviously much for the better. I think we need to do this with mental health. I think mental health is the last prejudice, really. I mean, I'm obviously a psychiatrist, and everyone knows I'm a psychiatrist, but I still occasionally have people in social interactions say things to me which are gobsmackingly prejudiced against mental health. And, if you said the same thing in terms of race or people's sexuality, everyone would be aghast. But, we still have a long way to go with changing public attitudes. And, the fact is that any of us can have a mental health problem. And also, if you think about the fact that there's the 25% of people who experience a mental health problem during their life, we've all got it in our families. So, it may be postnatal depression, it may be a childhood disorder, it may be a psychosis, it may be dementia, but it's really an issue for everyone. We need to get that message across. And also talking about it and detecting it earlier can only be a good thing as long as we do not overly pathologize people's conditions.
And can I just ask you specifically on that, with regards to stigma, do you think then that the pandemic has played a part in reducing this stigma now that many people are suffering these issues? And same thing in Parliament. We're now having members of Parliament from across the House, repeatedly raising the issue of mental health and, the support that's needed from the government during COVID-19. And therefore, a lot more people now, are experiencing those issues that you've highlighted earlier, whether it's depression, anxiety, day in, day out, with the restrictions they're facing. So do you think the current circumstances have helped to address the issue of stigma that we otherwise would have faced with regards to talking about mental health?
Yeah, absolutely. As I've said, I think the crisis has made everyone aware of their own mental health, and the fact we've seen other people, do badly. As a society, we've become more aware of how important it is. It's not something for other people; it's something which should concern all of us, really. And I think there's a moment here to be grasped, because what does tend to happen after pandemics is that eventually, and this may sound unlikely at the moment, normal life resumes, and then people tend to forget. If we think about the Spanish flu epidemic, which was such a big deal at the end of World War I and the year or so afterwards, that passed from popular consciousness. So I think we've got to seize on the moment with mental health. We've got to think about how important it is, because it's not just important in terms of things like suicide. The reason that people with mental health disorders have such a reduced life expectancy compared to others is partly due to suicide, but way more due to their physical health problems, because they tend to get poorer service from the rest of the NHS. And that must be at some level due to stigma and prejudice. So we really need to try and capitalize on this opportunity to make things better for the future.
And Professor, the next question I have for you is this: what do you think will be the immediate and long-term impact of COVID-19 on children and young people's mental health, especially with schools being closed? I know in your introductory remarks, you cover the issue of young people and how they will be affected by COVID-19 and their experiences at the moment. But what would you say from a mental health perspective are the challenges that young people will be experiencing, and what can be done to help them through these difficult and challenging times now and beyond?
Well, I think the challenge is huge. I think we will see lots of people who've missed out on what I've called the maturational goals, where you do your usual things with work and with school and then work and university. And there really needs to be a huge investment into trying to help overcome this and also promote resilience and to some extent normalize the views of mental health problems. I think there's lots of evidence that if you invest in children and young people, you do get a very significant return back from the Head Start program in the 60s under the Johnson administration and so on and so forth. I think there's lots of investment and there's lots of reasons for this, but I am extremely worried about school children in particular. And I think there's a clear way in which this may widen inequality. So our own experience has been that the children who are, for example, in private schools, there seems to be much more investment in remote learning or much more delivery of remote learning. And people who are in the state sector may be getting more patchy service. So I think we've got to really address this and try
and can I ask just on that specific point with regards to investment? I was reading the statement by the Children's Commissioner, Anne Longfield, and she said that an absolute minimum, all schools should be provided with NHS-funded counsellor, either in school or online. What would you say about that?
I think we need to make access to the introductory level of the mental health services much more available to everyone, and potentially as schools as well. But I would caution against doing things which we think are right, which may not be evidence-based. Remember, the first rule in medicine is to do no harm. And it's possible that we may actually be promoting, as I say, a more pathological view. This is a strange balancing act between reducing stigma, but also not overly pathologizing normal experience. So I think that's an interesting suggestion, but it would need to be scrutinized very carefully as to what the evidence was it would help. I've certainly seen from working in general practice, counselling services being provided, being immediately overloaded, and in actual fact failing. So I think we need to think about this. Other ways may be helpful. I mean, there's great belief in digital approaches and making things more accessible in that way. Again, that needs to be evaluated. There needs to be research to look at the benefits and harms of every intervention. I'm afraid to say that there's no way around this, whether it's a talking therapy, whether it's a medication, whether it's some form of device. We need evidence, because we just can't predict the balance between benefits and harms for anything. So that's an interesting idea by the Children's Commissioner, but I think I'd like to chew over it and see the arguments for and against it, really. And also whether it's the best use of money. I mean, of course, there is a limited pot of money, despite the Chancellor's magical powers. It would seem, and it's a duty on us to spend it in the most effective way possible.
Well, we've got the budget coming up in March, Professor Young. If you have any ideas or any suggestions on what more we could do with mental health, your advice is always valued by all. So do let us have those views, and we can put those into to the Chancellor ahead of the budget coming up in March.
I certainly will.
I can ask you a final question. I know we're running slightly over time, but I do want to get this question in to you. What simple everyday steps can people take to help improve their mental health? Because people listening out there, they want to know what can they do in these difficult, challenging times, which we're all going through, to help improve their mental health. What would you say are the key things that they could do?
Well, I don't think this is particularly requires an expert to say it. You've got to look after all of the various needs that we as human beings have. So one has to exercise, one has to sleep properly, one has to make sure that you have breaks, you've got to socialize, You've got to have interaction with other people, such as one is allowed to do. And you've got to look after your physical health. I think one of the worrying things is this suggestion there's been a real increase for some people in alcohol consumption. And that's understandable in a way. If you're in lockdown and you have a bottle of wine every night, you might think, well, so what? But in actual fact, that really is not very helpful. So I think we should be making a real effort to tell people to adhere to the suggested limits, which are really actually remarkably modest intake of alcohol. I think we also need to be aware that this pandemic will pass and that there will be a future. And also, if you look at, if one just listens to the news, as I've said, there's this drumbeat of negativity. I mean, personally, I don't listen to the news for longer than about 5 minutes because you can always get the news on your phone or whatever. And you've got to be aware that there's other parts of life which are functioning very well. I think there's a particular problem with Britain because I think in Britain we tend to be particularly negative and critical about ourselves. But in actual fact, this country's got terrific strengths. And I think that's shown by the vaccine program, which is really a sort of public-private partnership, if I can use such a term, which really is delivering massive benefits for everyone.
Professor, can I just say, I agree with you entirely. Don't listen to the news too much. Even me, in politics, I tend to turn off after a few minutes. So you've got to take it in small doses with regards to what you watch on TV. Can I just say a big thank you to you for making time to speak to me today, and also what you do day in, day out, and the wonderful advice that you gave to me when I was pushing forward the 2 private members' bills in Parliament on perinatal mental health care and transparency in the commissioning of mental health services. Your support and advice was absolutely superb. So thank you so very much for coming on and speaking to me today, and hopefully we can get you back on again sometime soon.
Well, thank you very much. Thank you for asking me. Always nice to talk to you. Thank you. Bye-bye.
Thank you. Bye.